Good afternoon, everyone. My name is Tisa Rodriguez. I'm an environmental planner, a community activist, and the chair of the Riverside County Democratic Party. Along with me today, I have Dr. Richard Loftus. Dr. Richard Loftus is a professor of internal medicine, a medical researcher, and a frontline hospital doctor taking care of COVID patients at a hospital in Coachella Valley. He has trained at UCSF and worked at the Gladstone Institution of Virology and Immunology. He is working on basic science and treatments for new diseases. He's also a community activist who helped start a homeless healthcare provider in Coachella Valley. Kate Schwartz has served as a licensed behavioral therapist for over 3 decades and served as the director of the Fallbrook Regional Healthcare District Board. Kate has spent her career advocating for healthcare patients and their families and has provided behavioral healthcare services within both the public and private sectors. Kate Schwartz is running for California State Assembly District 75, a district which encompasses parts of the Inland Empire, San Diego County's North region, and the southernmost parts of the Inland Empire. Leo Momara is a history professor and from a working class family background. For 4 generations, his family has worked with unions, including ILWU and SEIU. Liam is a past and present member of several unions, having worked as a longshoreman, a fry cook, and as a computer nerd. He later took on a lot of student debt to finish his PhD and has taught college for 12 years, where he focuses on the history of ideas, including public policy and economics. Liam is the Democratic nominee for U.S. Congress in the 42nd Congressional. I'd first like to welcome the many people who have joined us today on Zoom, Facebook Live, and everyone who's on Zoom is going to be muted today. If you're on Zoom, you can ask questions in the chat box. And if you're on Facebook Live video, you can enter questions in the comment sections. Please be aware that the Facebook Live feed is about 5 seconds behind the Zoom feed. If you provide questions that we do not have time to get to today live, we will follow up and provide written answers afterwards. Now we're going to start with Dr. Rick. Dr. Rick, would you please just give us a couple of minutes worth of information, talk to us about a little bit about your experience in the field right now.
Yeah, absolutely. Thanks, Tiza. So my background is in immunology and virology. I worked at the Gladstone Institute in San Francisco, where I did all of my medical training. I did med school, residency, and I was the second AIDS clinical fellow at San Francisco General. So I did everything in San Francisco. I moved to the Inland Empire 10 years ago to start an educational program at my hospital. So I teach internal medicine. I have resident doctors that train under me. I continue to do research. Most of my work of late is studying new drugs for drug-resistant HIV/AIDS. The issue with COVID-19 first came to attention to people in December when WHO announced this infection in China. We became aware of its spread to North America in late January, early February with Washington State. At that point, I was thinking that maybe it would still be like SARS or MERS, something that could be contained with careful attention. But as it started to clearly spread in Washington State in February, already medical scientists were raising the alarm all over the United States. I have a colleague here who was already acquiring protective gear because he saw what was coming in January. But by late February, when we saw some of the genetic analysis of the viruses circulating in Washington State, I realized that we already had probably back of the envelope 1,500 people infected in Washington State. And we still, in America, we're talking about this as a virus that would be coming from foreign travelers, people coming in from China, or maybe people coming from Italy. And I realized as soon as I saw the data in February that this was already on the west coast of the United States and was spreading. I put a big poster up on my office door for my residents about COVID-19 and that it was already in a generalized epidemic in the West Coast. Now, at that point, nobody acknowledged that, but being trained in virology, I could read the data and see that that was the case. And I knew we had probably 1,500 people in Washington already infected. None of them were identified. None of them had travel restrictions. All of them were free to get on airplanes and get into cars and travel all over the domestic United States. So at that point, I knew we already had an outbreak. It was also fairly apparent at that point that people who had no symptoms were able to transmit this virus unwittingly and spread it to others who could get seriously sick and die from it. In early March, I started raising the alarm with my hospital leadership. I remember sending an email to them, bolded, underlined, telling them, I don't care if I look like a crazy person sending this email to you all. If it saves some lives later, this is a NORAD 5 emergency. This is going to be catastrophic. This is going to be a 1 in 500 years event. I feel in retrospect like I came off like Sheriff Brody from Jaws. Close the beach, close the beach. There's a shark in the water, close the beach. And nobody was really listening to me. I think many medical scientists across the country were doing the same thing at the same time and all being looked at like we had grown a second head. By early March, while I was trying to get people's attention, I was very focused on having enough protective equipment for frontline healthcare workers. So I reached out to community activists, Shelley Bloom and Kay Gearhart in the Coachella Valley. I begged them to help us get citizens organized to start making masks in the community for frontline healthcare workers. And we are off and running, and that group is still producing masks for my hospital right now. I also connected with activist Chad Loader, who's now doing Masks for Docs is his organization, and they're producing face shields and masks and other equipment for frontline healthcare providers. He's also working with one of my residents on some fancy new kinds of ventilators that we think will work better for coronavirus. I just started connecting with people in the community who would understand that we were potentially going to run out of protective equipment pretty quick, and we need to start making these things regionally because we weren't going to be able to get them shipped from the outside world because pretty soon everyone was going to be demanding these supplies. March the 19th found me at a point where I was really urgent to get the Coachella Valley locked down into a state similar to what San Francisco had done because we had a circulating epidemic. I'd already admitted a patient with coronavirus. I had one of the first patients that died in the Coachella Valley as one of my patients. Couldn't really get anyone to take seriously that we needed to go into lockdown. And then, of course, Gavin Newsom on March the 19th, fortunately, thanks to being advised by science advisors and listening to them, put the state into a state of lockdown with restrictions on and basically implementing what we call social distancing. By later in March, some colleagues in my hospital were sick. One of my doctors on my service got very sick and was on my own coronavirus unit. I was rounding on him as his attending. And I was in a lot of distress about, the prospect of a lot of healthcare workers getting sick, which of course we still are. Many of you probably know New York and New Jersey, lots of doctors and nurses are getting sick with this. Now that I find myself in the middle of April, I can see, at least in the Coachella Valley, that the aggressive social distancing that citizens have done here seems to be helping us cope. We're not as overwhelmed at this point as my original projections, but we still expect things to get worse for us through the end of May or early June. But what I do see now is that the medical leadership all seems to understand what's at stake. People are working together. I'm a lot more hopeful than I was 4 weeks ago because I think people are starting to understand and believe this is real, and they're taking appropriate action. I hear a lot of lay people asking, when is social distancing going to end, as if they can get an answer that's a calendar date. And so as a medical scientist, what I tell people is, there's 3 things that can help us back off on our current aggressive social distancing. We need widespread testing technology, which we do not have. We're working on getting more of it, but until you have testing, you can't really lessen social isolation. I am thinking that we're not probably going to have tests available at the level we need until maybe August. I hope it's sooner than that, but I don't expect it. We will need to use testing technology to trace the infections and keep people who are potentially capable of spreading this, who are contagious, isolated until they're safe to circulate in the general population. We also need treatments that will make this infection less deadly for the people who get very sick. And we're probably many months, if not a year away from having widespread oral treatments for this infection that can make it less deadly. And the final thing we need is a vaccine, and that's probably at least a couple of years away from right now is my expectation. People say 18 months. People say, 8 months to get a vaccine. Well, it's usually 8 years to get an effective vaccine. And I won't go into the technical details, but this virus is very tricky to make a good vaccine for. So it's not easy like polio. it's more complicated. So the vaccine development is not necessarily going to be an 18-month job. I think we'll be very fortunate if we have something that works in as soon as 2 years. But I think we can get aggressive about testing and tracing, and that may be our best way to reestablish what looks sort of like a normal society again. And then the final comment I would make as a community organizer is to remember that the scarcest resource in crises is leadership. This event has knocked the legs out from under all of us. Our entire society has been turned upside down almost overnight. People see all kinds of problems in their community, and what I would say to them is, don't wait for someone higher up or those people to come fix that for you. You solve the problem where you are, working with your friends and neighbors. That is what is needed right now, is solving problems where you are best you can, working together. And look after the most vulnerable in your community. We're seeing in all kinds of media stories and in the medical data that it's our most vulnerable members of our society that are getting savaged by this infection the worst. Look after your elders. Look after the less well-to-do. Our African American and Latino patients are having extremely high death rates. So all vulnerable communities are being hit the hardest by this. So I would ask individual citizens to please look after the least of our brethren, look after the most vulnerable people in your neighborhood, check on that elderly neighbor, have a young person offer to run grocery runs for them or whatever you need to do to take care of them. You know, there's a belief that when something like this happens, it's zombie apocalypse and everybody starts shooting at each other. But actually, the sociological literature, again, speaking as a scientist, says, you know, when crises like this, it brings out the best in people. It brings out pro-social behaviors. People work together in a crisis. They help strangers. We help each other. That is what makes our species different from chimpanzees. So, you know, I have more hope than I did a month ago. I see a lot of people rolling up their sleeves and doing anything they can. Yesterday, an engineer who lives in Cathedral City brought to my hospital a decontamination unit for the masks that the doctors and nurses wear that he built on his own, didn't ask for any money. He brought it over and set it up for us completely for free, and it's there to decontaminate our supplies so that we don't go home, you know, potentially carrying infectious virus to our households, which was incredibly generous of him. And these are the kinds of generous acts that I see left and right around me right now. So I have a lot of hope. And then my final remark is just, please, those of you who are able to safely go outside, please remember to keep donating blood. We do need blood for our medical patients for lots of reasons, and we need those blood donations, and they've fallen off because of the pandemic. And I think I'll close there, and I can take questions later.
Thank you so much for sharing just a little bit about your experience here. We'll get deeper into questions that we have for you. I'm sure we're going to have a lot of questions for you soon. For right now, I want to go to Kate Schwartz. Can you tell us, please, Kate, a little bit about your background, about your race, and about your experience with behavioral health?
Of course. Thank you, Tisa. And thank you, everyone, for attending this afternoon's virtual town hall. We're pleased to have all of you. My name is Kate Schwartz, and many of you may know me. I am running to become our next representative in Assembly District 75, which does cover the southern portion of Riverside County, as well as North County, San Diego. I am a native Californian, born and raised actually in Sacramento, and I received my education through our California public education system through my undergraduate degree. And then from there, I moved to New York to attend Columbia University, where I earned my Master of Science degree in clinical social work with my concentration in health and mental health. I continued my studies and completed my postgraduate training in New York City and Boston, and then returned back to California with my family and settled in Assembly District 75, and I have been here now for 20 years. As I mentioned, I have always, I received my degrees at concentration in health and mental health. I've always worked in public health settings and community health centers, usually providing services within the behavioral health department. I have created social support programs for various community health centers, run behavioral health departments. I have also co-created residential treatment programs, a crisis residential treatment program for young adults aged 18 to 25, and have served my communities for 3.5 decades in this manner. I decided after serving at this level, I moved up to a local government post. I currently serve as the director on our Fallbrook Regional Health District Board. Of recent, I have suspended my campaign in order to better serve the community during this public health crisis. And at the Fallbrook Regional Health District, we have been increasing our supports to our more vulnerable community members. We are supporting our Fallbrook Food Pantry, as well as our Foundation for Senior Care. And I'm also working with local community health centers that are providing migrant education to our migrant farm workers. So I've also been involved in a campaign with contacting seniors and doing wellness check-ins and whatnot. So I've served in both public and private sectors as a licensed clinical social worker and behavioral health clinician. As my expertise is listed in that for today's town hall, I thought I would speak a little bit to some of the behavioral health issues related to managing our reactions, our emotional reactions to the current COVID-19 crisis. And I thought I would talk a little bit about anxiety and the importance of self-soothing and what suffices to provide soothing to most of us. An important aspect of our development is learning how to soothe ourselves, as I mentioned. The environment also soothes us. We probably all noticed today when we woke up and the sun was shining that we were in a much better mood and probably felt a bit more hopeful and a bit more positive. Connection with others is another way that we are soothed. Self-care, exercise, meditation, proper sleep, proper nutrition, helping others. For some of us, faith is involved, and that is spirituality is very soothing to us. It's important to think about with our own types of coping, how we have coped ourselves with past challenges in our lives, because those are our strengths that we need to work from in order to manage these uncertain times. Regarding managing anxiety, there are three aspects to anxiety management that we typically focus on. The first is the physiological, and those are the sensations that we feel in our bodies in response to holding anxiety within. The most extreme mode is what many people know of as a panic attack, and having that type of sensation, where many people experience that and think that they're having a heart attack. But generally, physical sensations and anxiety can involve more rapid breathing, changes in our pulse rate, hypervigilance, as we call it, which is being much more aware of our surroundings because we're looking for danger. And sometimes some people feel very tense. They might even feel ill and flushed, sweaty palms, all of that. The best treatment for the physiological aspect of anxiety is always going to be calming activities. Exercise is great, and that's why currently San Diego County Live Well program is recommending 60 minutes of exercise per day. Also relaxation exercises, yoga, and again, meditation. The second aspect of our responses due to anxiety are cognitive, and those are usually the what if thoughts. What if this happens? What if that is going to happen? Those are anxious thoughts, we call them, and the most helpful way to respond to those is first to become aware that they are only anxious thoughts, and then to begin doing some deep breathing and redirect yourself to more productive activities, redirect your thoughts to what you can do today to feel like you are taking control over the situation, okay? The third aspect of treating anxiety is behavioral, and that typically is viewed or is observed as some form of avoidance. In this respect, that's already taken care of because we're all sheltering in place. So we're supposed to be avoiding one another and staying to ourselves and making sure that we are using social distancing and whatnot. It's natural to feel trapped when we need to stay inside like this. It's not natural for us to be away from others. And just as we're doing today, we're finding new alternative means to connect with others and to continue with some of our tasks and some of our work. You can escape in your mind from feeling trapped. You can also use technology to look at very relaxing locations and whatnot, and also consider the future and things that you might do in the future that are pleasurable. Taking a break, obviously, from the news and a lot of the worries is also going to help. And if you are entertaining dark thoughts, more of on the depressive end, to again redirect those thoughts to more hopeful, more positive thoughts about the future, the positive things that can come from this experience as we grow through it. A worry journal is used and is great for constant worry due to anxiety, and you can simply look that up and see how to utilize a worry journal. I also have many resources, an entire myriad of resources on my Facebook page. If you go to Kate Schwartz for Assembly 75, you will see them. And I have plenty of resources as well for parents with homebound children, how to manage that stress, and also how to help your children manage anxiety and uncertainties. I also would recommend a little bit of reading on the psychology of resilience. And that it really has to do with positive adaptation to challenging events in our lives. Thinking about the areas of your life that you currently can take control over, we always recommend maintaining your routines as much as possible, having predictable times every day where you're going to be doing your usual activities and whatnot, making sure that you make time for exercise, trying to connect daily with important people in your life, and also to reach out and find ways that you can be helpful to others. Living in the moment is helpful, and thinking about leading from within. So the notion that rather than allowing the environment to control you, you are going to lead from within, from a spiritual place, and feel more in control of your world and what's happening to you. And of course, finding the right traveling partners in your communication supports and maintaining those important supports in your life will also do a great deal to help you manage the stress of this uncertain time. Please feel free to go to my website, kateforassembly2020.com, to learn more about myself and the reasons why I'm running and the Assembly District 75 seat. My platform is going to focus on health, housing, highways, homelessness, and habitat. If you have any questions, feel free to send them over in the chat and I'll be happy to respond. Thank you for your time.
Thank you so much. That was incredibly helpful and good information for us all to consider and put in practice. Now I'm going to go to Leo Momara. Can you share with us for a few minutes, please?
So yes, I'm Liam O'Mara, and I'm currently a professor of history at 3 Southern California campuses, as well as the Democratic nominee for the 42nd Congressional District. We're living through a challenging time in our history, and we'll need to be a lot more proactive in our response and a lot more empathetic about the suffering this is causing. You know, I was pretty sick recently for a couple of weeks with the main symptoms of coronavirus. But since my fever was pretty low, my provider decided they couldn't use one of the tests and had to ration them for people much worse off. Now, I don't think I had it, though some in my family were convinced I did and terrified. But since the symptoms are not perfectly consistent, I could have had it and without knowing could have spread it to others. And this was worrisome to me. Why are so many in this situation lacking testing and clarity? Broken public policy. So I'd like to start talking policy with a quick parallel to the 1918 pandemic and share something about it that too few people in the media are addressing, that it lasted about 2 years. There are things we can do to lessen that, most notably the social distancing I'll come back to in a moment. But if anyone is expecting a miracle drug that eradicates this in a few months, they're missing how this stuff works. We're a year or two away from a vaccine, and that's assuming it doesn't radically mutate. But we need to be prepared for this to be just as strong in the fall as it is now, given that cooler periods help such viruses to spread. And it will be just as bad if we don't practice the social distancing now and for quite a while. We have far too many influential scientific illiterates calling for the quarantine to end by Easter or whatever, or claiming the cure is worse than the disease because of the economic fallout. And Republicans are not doing enough to tamp down this nonsense either. I heard the exact comment in a telephone town hall held by my opponent, and he didn't push back on the idea. But here's the problem with that. Not only would ending social distancing allow more people to spread the infection as carriers, extending its run, but the bad cases would increase manifold and overwhelm our hospitals. That in turn would cause patients with different problems to die simply from lack of treatment. We only have so many beds, so much staff, and so many hospital wards. Do we really want a return to school gymnasiums transformed into makeshift hospices where people wait to die? Do we want people with heart attacks or in car accidents and the like to be neglected because there's not enough staff to treat them? We have elected officials and pundits effectively telling us that they are okay with you dying, with your parents dying, your children dying, just to keep the economy strong. Such statements are wrong on so many levels, but not only that, it wouldn't even help. Newsflash, hundreds of thousands of people dying quickly will have an adverse impact on the economy too. If we take seriously the complaints from the right about economic damage, why are they resisting so many things that would lessen it? It shouldn't have been so difficult to get through the expanded unemployment benefits that Democrats sought. And hearing GOP politicians claim it would encourage people to quit so they could mooch off the government makes me wonder what planet they're living on. Unemployment is a particularly poor way of dealing with this, though. A friend had her entire company liquidated in a 5-minute meeting. Well, except for the executives who, of course, continue to pay themselves. But our entire approach is backward. And countries like Australia, Canada, Denmark, Germany, the Netherlands, and the UK have been using wage subsidies instead. With this, the state takes over payrolls at 70 to 90% of salary levels for the duration of the crisis. Even poorer countries like Bulgaria have been doing it. The advantage is that you don't need to hire and train new people, and you don't have a huge spike in the unemployed with all the negative impacts on consumption and the like. And that makes it cheaper in the long run. Then there are supply shortages. Why are we not using the Defense Production Act extensively, and why did we wait months before even considering it? It was designed for just this sort of emergency. Trump now claims he thought it was a pandemic before everyone else, but if that were true, his actions would be even more criminally negligent. I can tell you from experience that shortages in testing are causing a lot of anxiety. We live in an absurdly rich country that can't manage to test all sick people, but South Korea was doing it at an industrial scale almost immediately, and have tested at more than 6 times our rate. That this slowed the spread there should not be ignored. Some of the fault for this can be laid at the feet of our for-profit healthcare system, which stands apart from the entire rich world in the extent of its waste, inefficiency, and care rationing. 28 million Americans have no health insurance and would not think to seek care unless they were in dire condition. Tens of millions more are underinsured and have to make similar calculations. My own plan has a lot of $100 copays, and that's not easy for many people to afford. The US spends twice as much as any other rich country and still can't cover everyone. How is that inefficiency not a massive scandal? A single-payer model would lower expenses for hospitals, allow negotiation with suppliers to lower unit costs, and leave more dollars for actual health care. Finally, I'd like to point out the benefits of paid sick leave. We are unique in the rich world in having no federally mandated sick pay, with the result being over a quarter of US workers have no guaranteed time off for illnesses. When facing a pandemic situation, we need people to be able to stay home without losing their jobs, period. If someone has to face a choice between not being able to pay his rent and possibly getting other people sick, a whole lot of people are going to take the latter option every time. Paid time off for illnesses needs to be part of the price of doing business in the US, just as it is in every other rich country in the world. And I'll just conclude my time by pointing to the dangers of electing politicians who let ideology override evidence, basic science, and history. Shutting out information that doesn't suit your biases has no place in responsible governance. We can get through this calamity as we have every other in US history, but it'll take coming together, helping each other out, and it will take elected officials who can put the public interest above their own or their donors' interests. Thanks so much for your time.
Thank you so much. So we'll start on a few questions, but let's start close to home with what we can do. So the first question we have is, what are some ways people can stay physically and mentally healthy while stuck inside during the pandemic? Who would like to start?
I can take that. Do you hear me?
Yes.
Okay, great. Okay, this is Kate. I would like to refer you to some resources. It's the San Diego County Live Well website. They're COVID-19 resources, and they have plenty of links for activities and ideas. I would also like to share that presently the YMCAs are offering 3 virtual classes for all various age groups, for exercise, for activities. They have coffee chats for seniors virtually. And I think that is so wonderful that they have stepped up to offer these services for our communities. So please check those out as well. Go to my Facebook page where you will find a multitude of resources for online services and assistance with getting active. Thanks.
Yes. Dr. Rick, do you have some input too?
Yeah, I would just tell people that, there's a lot that they can do to look after their physical health just from the basics that they already do. I think in stressful times, and I'm sure Kate can speak to this too, people don't always eat very well. They want to eat their Pop-Tarts instead of their fruits and vegetables. But I am a doctor, so I'm going to tell you, please eat well. We may rely a little bit more on processed foods that store on the shelves, okay, but please remember fresh fruits and vegetables are your friends, and they still have them in the grocery store, so please eat them. And you can do a lot of exercise, even if you're, staying at home. You can do exercises in your backyard, and that's perfectly safe. You can even go out for a walk as long as you maintain social distancing. Wear a mask when you're walking around the neighborhood, and keep your distance from folks. 6 to 10 feet is safe. And, don't refrain from going outside and enjoying nature because you can do that, and it's good for our physical health, and it's good for our mental health as well.
And Tisa, if I may add for the audience, if they would go to San Diego County Live Well at Home, that is the website where there are many suggestions for at-home exercise and recreation.
Wonderful. So the next 2 questions are a bit split. I have one that's more specifically for you, Kate, which I'm going to take first, and then I have one for Dr. Rick that I'm going to go to. And this may be a bit harder to point to, but I'm sure there's more local resources. The question is, are there government plans in place to provide professional counseling and ongoing support to California's healthcare workers who are being traumatized by their work on the front lines?
It's an excellent question, and I did see that in the chat. And the answer should be yes. I mean, I'm one of those healthcare workers, and certainly all of my coworkers are. Most work sites have employee assistance programs, and also now you can virtually, through telemedicine, be allowed to see any type of providers that are needed. So behavioral health care providers are available through telehealth sessions, and employee assistance programs at each work site typically direct and guide their employees and their staff toward the local services and resources. So that's a good place to start. And then going to your particular insurance plan as well and contacting them, or going on to your online providers. You can look up behavioral health providers, and you can find plenty of behavioral health providers to get some counseling started. There's also family counseling, that would be available. Typically, we would start with an individual patient assessment and then determine what we think would be the most helpful for that individual.
So this next question is for Dr. Rick, but I think Liam, you may actually be able to help with it too, because there's a bit of history to it. Wouldn't we be in a much better position to deal with public health catastrophes like this one if we had a national health care system like the British NHS or Canadian Medicare? So it's a bit of a policy question. What are your thoughts?
Well, yeah, that's right up Liam's alley, so I'm going to let him speak about that more. But speaking as a doctor in a healthcare system that had to start a homeless medical outreach to reach some of our most vulnerable patients, yes, all the other 34 OECD developed countries do this way better than we do for a lot less money and a lot more justice. The whole idea that most people get their health care through their work, and then they get sick and they can't work, and then whoops, all of a sudden their health care goes away. How did that ever make any sense? It never did. It's always been a problem, and this situation has laid bare how bad that is all over again, on times 10. So I'm going to let Liam take over on the policy piece, but speaking as a frontline healthcare worker who cares about just distribution of care to every person in our citizenry, yes, we have a terrible model, and it's needed reform for a really long time. And I'll let Liam finish.
Thank you, and I'd like to speak to it as well.
Yeah, the employer-based approach makes no sense at all. And I think the massive spike in the unemployment rolls is really going to drive that point home for a lot of people. It has never made sense. It's poor in every possible way. The fact that people can't move states easily, move jobs easily, because they're always worried about losing their healthcare coverage, this is not a problem anywhere else in the world. And it's just one of many reasons that we rank at the absolute bottom of the WHO's ranking of healthcare systems. We have the worst overall system for people, despite being the richest country in the history of the world. It makes no sense at all. Whether or not we need something like the NHS, the National Healthcare System in the UK, that's that kind of fine detail. Ultimately, there's a whole bunch of ways to approach this. There are three major ways to approach it. One is with a public-private cooperation like you see in the Netherlands or Germany, where everyone is covered and a lot of the provision is done through private, or entirely through private means, but all the insurance is still, you make sure that everyone still gets coverage no matter what their employment situation is or their financial situation, it's all covered. Or you have a single payer model, which is what Medicare is, where providers could be still private, but there's only a single insurance provider that takes care of everyone, and you take out the competition amongst all the different policies. And again, you remove the employer situation completely from it. Or you have the entirely socialized system like you have in the UK. No single model is necessary to achieve universal health care that would make us much better off. Literally any of the three would have been better than what we have. I tend to prefer the single payer approach, but there are good arguments for any of the three.
And Kate, you had thoughts too?
Yes, I would like to add that that actually my passion in wanting to move toward the state government and become your next representative for our assembly district is my passion for healthcare for all Californians. You would find that there are very few healthcare providers who are not in favor of single payer or some form of universal healthcare, so that everyone is covered, that we remove all of the waste and just excess administrative costs that are so unnecessary. I've been practicing now for 35 years in my private practice as well as for community health agencies. And I've seen the costs just skyrocket with the level of care and the availability of care really deteriorate. 25 years ago, we had copays that were $5 to $10. Today I'm seeing patients with $40, $50 copays, deductibles, annual deductibles of up to $6,000 annually. And the premiums are so high as well. It does begin to make people wonder why do I have this health coverage? How is it actually assisting me? So, for-profit healthcare, is designed to make a profit. And way back when President Nixon was considering the legislation or the executive order, regarding private for-profit health plans and HMOs, he asked his advisor, doesn't this mean that they would need, meaning the for-profit companies, the insurance companies who wanted to move into healthcare, who, by the way, had not been necessarily in the healthcare industry at all prior to that. But he realized, he said, doesn't it mean that they would have to somehow lessen access to care in order to make a profit? And Nixon's consultant said, yes, in fact, that is the case. We as providers see that and have seen it over time. We would really like to see patient care take precedence over profit, people over profit. Thank you.
So the next question I have, it cuts really close to home. It's how cautious should we be with mail, packages, and groceries as we bring them into our homes?
I think I can field that one.
Okay, go ahead.
So the medical literature suggests that the virus can persist on certain surfaces for a while. On metals, except for copper, and plastics, we can find viable virus as much as 3 or 4 days. Sunlight helps break it down faster. On copper and zinc, the virus lasts less time, 6 hours. On cardboard, it lasts about 24 hours. So I advise people to let packages sit for a day if they're, a typical cardboard or paper. Certainly bleach breaks down this virus right away. Ultraviolet light, like you find in sunlight, helps break it down faster. If you have an ultraviolet system, like we use in a hospital to decontaminate materials, that works within a couple of minutes. I actually have an ultraviolet light box that I use to decontaminate my phone several times a day, and it takes 90 seconds of ultraviolet B to clean stuff. But sunlight will work slower, but will work. But I advise people who are bringing in objects from the outside world to wipe it down with bleach. You can use 2 to 4 teaspoons of bleach in a quart of water, and that will make a dilute bleach solution that you can use to wipe things down, or you can use Clorox wipes, of course. There are other kinds of wipes, sanitizers that you can use. You can read the directions. They usually suggest that after you wipe something, you let it dry for 2 to 4 minutes before you pick it up. And of course, I tell people, wash your hands, wash your hands, wash your hands. If you're touching anything from the outside world, immediately go and wash your hands with soap and water. Besides bleach, soap and water is another excellent way to completely destroy the virus particles, and careful attention to hand washing will go a long way towards keeping people safe.
So the next question I have is, how do we respond empathetically to feelings of being nearly under house arrest due to the restrictions or the stay-at-home orders?
I mean, I'm hardly a healthcare or a social work expert on anything like this, but I can just point out something that's useful to me, kind of a lesson that I take from Stoicism, and that is to focus on the things that I can control. I can control my reactions to things, I can control what I do, but I can't really control the fact that I need to stay at home. So if I can shift my emphasis a bit, if I focus in on only those things, I find that I can just relax and let go of those outside restrictions.
I would add that if we think about the words we're using on house arrest, how is that going to make us feel internally? It is probably going to increase our anxiety level and probably some anger and resentment as well. It certainly is not going to help us, I think, adapt. So the thinking needs to be instead, okay, this is a new situation. I haven't been faced with this previously. It's a challenge. How can I help myself to adapt productively to it? Not using, say, substances or other destructive ways to while away the time. But what can I do in my world? And as Liam was just mentioning, that I have control over to turn this into a positive adaptation. And that's exactly what resilience is. And resilience is what helps us to get through these adverse times. So think about perhaps ways that you can create less of that feeling. It might be, as Dr. Rick suggested, exercising out in the backyard, and if not, doing some things in the house to exercise. It can be finding enjoyable activities within the environment in which you are in order to make yourself feel productive and feel good. It may also involve distracting yourself from that feeling and saying, okay, that's a negative feeling, this isn't going to help me. What can I focus on instead? Can I focus on helping others, doing some volunteer work, getting tasks done, becoming productive, and doing some of those relaxation exercises and meditation, I also think would be very, very helpful in helping to disperse some of that internal feeling.
Can I chime in a little bit too?
Sure.
Yes, please.
I applaud what Kate just said, and I second it and third it and fourth it. I think, and what Liam said as well, a lot of this is your mental outlook. If you're telling yourself again and again, I'm in prison, you're just going to go bananas. What I would propose to you is, thinking as a virologist, you have a viral tornado outside that wants to come after you. And your home right now is not a prison, it's a storm cellar. It's your protection from the storm. And so as a medical provider, I would like to welcome people to realize when you're sheltering at home and minimizing your circulation in the outside world, you're protecting yourself, and that's protecting everybody else, including people like me, who, if we let down our guard against this virus prematurely, my hospital is going to get overwhelmed, and I'm going to be intubating people in the emergency room and probably running out of gear and running out of supplies. So all of us have to work together. So don't think of your home as a prison. Think of your home as a shelter. It is protecting you from a storm, and it's protecting all of us from a storm. And I agree with Kate. Ask yourself, what can you do to help those less fortunate than you? And it's a lot. And thanks to the beauty of the internet and things like these Zoom rooms, we can reach the outside world, and we can reach people and influence things without putting ourselves at physical risk while this viral situation is circulating, until we can get it under control. I am more hopeful than I was even a month ago about our ability to do this, but we're all going to have to work together. We're going to have to trust each other, and we're just going to have to link hands and help each other. But I do think we can come around this situation as a society if we all work together.
The next question is about gloves. Because gloves can carry forward whatever they touch, is their only benefit blocking the wearer's germs from being spread via their fingers? So how do gloves protect us, and do they help us protect other people?
That's a quick one, and I'll chime in because that's my department. Gloves will protect you from getting germs on your hands, but gloves are really good at spreading germs that you get on the gloves if you touch stuff. So the problem with the gloves is, you got to remember that if you're barehanded, just soap and water all the time to clean the germs off your fingers. And if you're wearing gloves, you probably need to put hand sanitizer on those gloves to keep them free of virus as you touch doorknobs and other things. And by the time you get home, if you're wearing gloves out in public to protect yourself, you got to throw those gloves away in the garbage can and immediately scrub your hands with soap and water really good to make sure you're not carrying any germs into the house. But gloves, really the benefit is, only to kind of keep them off your skin. I would still recommend washing your hands once you take them off. And remember, if you're touching stuff with those gloves, they're getting smudgy with germs, and they can spread those germs if you're not careful. Part of the benefit of people wearing masks is it keeps them from touching their faces, which either means they're not taking their germs and spreading them into the universe, or having their fingers covered with germs and inadvertently introducing them into their body by touching their face. So gloves kind of help, or masks kind of help in two ways. But gloves, can spread germs too if you're not smart about them. So when I wear gloves, like in the hospital, which I do sometimes, I actually use hand sanitizer on the gloves to remove any germs that got on those gloves so the gloves don't spread anything. And I always wash my hands with soap and water right after I take the gloves off.
I have a quick question for Dr. Rick there. I was told years ago as a food service worker that gloves actually held the germs better than your bare hands did, and they made us constantly take off and change the gloves throughout the shifts there because of that. Are they actually worse than bare hands in terms of holding the germs?
I don't know any specific literature about that per se, but I would say that we know that plastic surfaces, like some of the plastics that we make gloves out of, are kind of friendly to viruses. That's true. Whereas probably our skin has some natural molecules to sort of deter invasive infection. So there probably is some truth to that. And yeah, I think the difference is that probably you weren't sanitizing those gloves while you were handling food, because that would be gross. Nobody wants hand sanitizer in their food. So it would make sense in that setting to change those gloves an awful lot, because yes, the germs can hold on to the plastic probably even a little bit better than they can hold on to skin. That's probably true.
All right, so we have a question about some of the data in the county. So while the curve in California seems to be flattening, the curve in Riverside County is not. Can you speak to reasons for this? Why has our rates and our sickness rates and our death rates continued to increase while other counties around us have not increased?
Yeah, I saw that data this morning, and I was also really disturbed by it. So it looks like our adherence to social distancing in Riverside County is not very good. 30%, maybe 40%. So it means there's a lot of folks that are not isolating, that are not limiting their circulation, that are hanging out in groups and close to each other where it can spread virus, not wearing their masks. In other words, just not doing all the things that the CDC would tell people to do. And if people don't do it, then it doesn't work. Even with masks, even if about only half the people wear them, it still helps an awful lot in terms of preventing transmission. A lot of our projections for anticipating how bad this could get cannot really factor in the variable that involves how people are doing social distancing and how consistently, because human behavior is so complicated. What kind of mask are you using? How frequently? Are you using it 100% of the time or 10% of the time? Are you wearing gloves when you go outside? Are you using hand sanitizer on those gloves? Are you really sticking just 6 to 10 feet away from people? So all of that is super complicated. And so it's really hard for projections to factor that in when trying to anticipate where this could go. But I want to remind everyone, this infection spreads exponentially, which means you can have pretty much nobody sick in the community, and 3 weeks later, you've got a bazillion people. The doubling rate in Riverside County for infections is about 4.5 days. So this thing will explode pretty fast if we let our guard down. And it looks to me like the big answer as to why Riverside County doesn't look as good as the rest of California is that most of the rest of the state is really being consistent in the social distancing practices by their populace. I got to tell you, in the Coachella Valley, we're seeing a flattening of our curve based on our own valley-wide projections, which tells us that probably people in this valley anyway, in this part of the Inland Empire, are doing a good job adhering to social distancing. And that's probably why my hospital didn't run out of beds, because my original math told me we might run out of beds right now, and we have not. And that doesn't mean we were wrong. It means that the people are doing social distancing and it's working. But we know that social distancing is not being practiced very well in the county as a whole. And that is probably why the curves still look terrible for Riverside County. And that would be my answer. So this is really a big challenge for public health education. We really need to get the message out. We need to educate the public and get people to understand what they need to do to keep society safe and keep themselves safe.
I have a quick thought on that one. If we've got a moment.
It's really quick, and then we'll get to the last 3 questions.
I wanted to add something as well after.
Okay, I'll be very brief on it.
Sure. Yeah.
On some level, I hate to make it a partisan issue, but we should point to the fact that a lot of the conservative media in the area and the conservative social media have been specifically attacking the ideas of social distancing and arguing against it. So on some level, the fact that that's a bit more prevalent or more widespread in Riverside County versus LA County may be having an impact on people's behavior.
Mhm.
Yeah.
I would just like to add that this morning I did read in the statistics that they were noticing only a 30% decrease in activity level in Riverside County. And Dr. Rick may be aware of that and probably have more information about that. But I had wondered if some of this might be due to the nature of the work and the workers in Riverside County, that they're maybe more of the lower paying jobs, and these workers not having benefits and needing to go to work, and more of the delivery jobs and things like that. It's just a thought of mine. I don't have data on that.
So the last three questions we'll go to. First one is one that I think a lot of people who are interested in helping small businesses, local businesses, are concerned that they still have. When we bring home takeout food, what do we need to do to make sure it's safe to still be able to eat it, to support our local restaurants?
Yeah, I would just say wipe it down with a wipe, whether that's a bleach wipe or some other sanitizer wipe, and let it sit for a couple of minutes so the outside of the boxes are clean. You know, most restaurants are also very aware of how to keep their food clean. In fact, I saw one pizzeria talking about how hot they make the pizzas before they send them to your home, to try to remind people that this food is coming hot and that keeps it free of germs, which is true. But I think the workers who are doing deliveries are also wearing gloves that are sterile, and the emphasis on making sure that the packages don't, pick up germs in the outside world while they're coming to you. But if you're concerned about it, what you should do is just use one of those wipes, let it sit for 2-3 minutes, 4 minutes at the outside, and then you're probably okay to handle it, no problem. That's what I do in my home, actually.
So we have a question about masks, the face mask that we should all be wearing. It says, I frequently see people wearing masks wrong. Can you please give us a quick example of how to properly wear one?
I actually moved to a different office and I don't have any masks on this desk. I have 4 of them on my normal office, but this was a better place to have quiet for the broadcast. But, any mask that keeps your face covered is probably fine. In fact, there was a great study done in Australia in 2006, 2007, and they found that even just simple surgical masks, any cloth mask that fits over your face, can help reduce your chance of getting any kind of respiratory virus about 80% if you wear it consistently. And when you say people are wearing them wrong, I mean, I suppose if they're hanging off your face, of course, halfway, then it probably won't work that well in terms of protecting you. If it's, does it have to make a perfect seal against your nose and mouth? Well, probably not for laypersons. For those of us who are in, like my COVID ward, where people have the coronavirus and they're patients that are coughing the virus into the atmosphere, I have to wear a respirator mask that's for medical workers that has to form a perfect seal on my face. And I actually have to go through testing to make sure that I get a perfect seal with that mask to make sure it works for me properly. But for laypersons, I would just say, as long as it's covering your face, it's doing its job, which is mostly protecting you from inadvertently introducing germs to your face, but also preventing you from inadvertently picking germs up off of your face and spreading them if you happen to have an infection. So I would just say, as long as it's fitting comfortably so you're not fussing with it, it's probably doing its job. If it's fitting uncomfortably and you're touching it a lot, it's probably undermining what it's supposed to do for you.
Mm-hmm. So the last question we have is, what else can we as a community do to protect residents of our nursing homes, our unhoused neighbors, and our incarcerated people? What can we do to help? And actually, you know what? I think that gets right into the next phase that we have, because we have some of these different resources that you all have been so kind to provide. And I think this is really this is exactly where it leads us. So I'm going to start with you, Lam, because you have a couple of local ones here. So can you share a little bit about HOPE?
Oh, okay. Well, I was going to say, I have a couple of quick points on that question about what we can do that actually connect to some policy points. I mean, the first I would say is, why are there unhoused people? we need to pick people up off the streets and take care of this. And we need to make better use of the resources that are already available, and we need to expand those resources. And the prisons being massively overcrowded, they are a problem already. And we've built more prisons than schools for a long time in California here. I think we need to release a lot of the nonviolent offenders, particularly like nonviolent, personal drug users, things like that, in order to lessen the actual number of people there, so you don't have people jammed so close together sharing cells. Because we've already seen a couple of cases back east where it has taken off in prisons. As far as the resources, I'd like, if anyone wants to help out or donate, the Hope Food Pantry, capital HOPE, and sponsored by the Dream Center in Lake Elsinore, is always taking donations, and they help out with a lot of that homeless population and can take care of people. Especially, given so many people already being out of work, there's going to be a lot more food insecure people than there were before.
And Tisa, I'm sorry, can you read the question again?
Yeah, absolutely.
What was the question?
Yeah. What else can we as a community do to protect residents of nursing homes, our unhoused neighbors, and incarcerated people? So what can we just as lay citizens do to help?
Okay. I'll defer to Dr. Rick on the nursing home situation. Certainly, I know that one of the issues with the nursing homes are healthcare workers often work in more than one home. So I know that has added to some of the transmission. But in terms of what the public can do, I agree that I think our first level of concern needs to be on food security. And so definitely contributing to our local food banks. I have some listed as well under my resources, North County Food Bank and the Food Bank in Temecula, the Fallbrook Food Pantry as well. Also making sure that we donate blood if we are eligible to donate blood, to make sure that we do that. In terms of homelessness, I would say I'm actually very, very proud of California and the policies that California has been implementing. I think our leadership really is an example for the nation. And I know that we have been moving a lot of the homeless into shelter and ensuring that there are public health services available to them. An example is in San Diego County. I know that they are housing people at the convention center and providing both the public health services and behavioral health services there. And that's just one small example. I also think it's notable that once this pandemic hit, that our state was able to find resources and able to find solutions to sheltering those who had been without shelter. And I think we need to ensure that we continue to do that. It's definitely on my top list of issues for intervention when I reached Sacramento. I did participate in a team that created a crisis residential treatment program for homeless youth. And so providing housing first, the Housing First initiative, that's something that we practice in the state of California. And the concept behind it is that all of us need to have our basic needs for food, shelter, security, and safety met before we can approach or get on the path of personal stability and realizing that. So pursuing Housing First initiatives in our state and nationwide is very, very important, and has been shown, it's an evidence-based approach, which has been shown to be the most successful, including in other countries, in helping the homeless to achieve stability and stable shelter.
Wonderful. Dr. Rick, you have some thoughts too?
Yeah, on the nursing homes, it's reminding me, earlier this week, we had an unexpected collapse of a nursing home in the region where the workers just stopped showing up. And there was an outbreak of COVID in that facility. So I've got a couple of people on the COVID unit who were testing to make sure they don't have coronavirus before we get them placed in new nursing centers. But in thinking about what happened there, I'm sure a lot of this had to do with this issue of the lack of protective equipment for frontline healthcare workers. And while I think the focus gets put on those of us who are doctors in the emergency room or the hospital and our nurse colleagues, people forget that there are people doing very important medical jobs in places that maybe aren't quite as glamorous as a hospital, and especially the nursing homes that take care of our vulnerable elders. And so I can tell you that one of the charity groups that I sent the link for this broadcast is my team in the Coachella Valley. And as soon as we announced that we were starting to make masks using people in their private homes to make masks for healthcare workers, we got contacted by 2 of our nursing centers asking for masks because they didn't have any, which was a little unexpected. It's like, wow, we just got started, but it kind of put us on notice that we had a lot of facilities that aren't hospitals where the workers did not have enough protective gear. And those are places that are experiencing infections in their employees and then, of course, in the patients. Many of the nursing homes now have a no visitors policy to try to limit introduction of infection. But as was pointed out, because workers, especially in nursing homes, work in multiple places, they may get exposed to an infected patient in one place due to lack of protective gear, and then carry it to their job to another facility and introduce the infection there, which is dreadful. So everything that we can do in terms of policies, which means our votes and the political movements that we support, that focus on making sure healthcare workers have protective equipment, but also charities that produce healthcare equipment for frontline healthcare workers, that's a good place to put your energy right now. And I like to remind people that although people put their focus on the nurses and doctors, there are medical assistants and physical therapists and other kinds of healthcare workers whose work is just as vital to taking care of our patients. And people forget that they also need protection just like the doctors and nurses do.
Right. So before we wrap up, I would like to remind everyone that we will provide links to all of these important causes so that you can get involved and you can ask questions, figure out where you can best, help. Whether you want to help make or find PPE, or whether you want to help make a difference with with providing services, whether you just simply need food. Sometimes we just have things that we need or that we need to be able to help other people with, especially right now. And so we'll be providing those links after the fact, so you'll be able to get directly involved with any of these causes. So now I'd like to give each of you an opportunity to kind of just wrap up anything you didn't get to talk about, you'd like to talk about just briefly. We're going to go in reverse order of the way we started. So we'll start with Liam, then we'll go to Kate, and we'll go with Dr. Rick.
Hi, so just in the interest of time, I'd like simply to point out again that I am running for Congress for Southwest Riverside County, the 42nd District, and I'm running to try and correct a lot of these basic problems we're seeing. I mean, there was a few questions here in the chat about some of our local officials not enforcing some of the restrictions and whatnot. We need better leadership all across the board here, and Riverside County deserves better leadership on these issues and people able to pay attention to the science of public health. So again, I'm running as a historian, and I'm hoping to be able to bring some of the lessons into the public sphere. So I'll pass over then to I guess Kate is next. Thank you very much for coming to this, and thank you very much. And this was very informative, I think, from everybody, and I hope you guys all got something out of it.
Thank you. And I wanted to thank you for the opportunity to speak with all of you today, and so glad that you were able to join us. As Dr. O'Mara was just mentioning, I too am running for my Assembly District 75 because I don't feel that we have strong representation for us, the people in our district. I feel that our current representatives' priorities are outside. Most of us are the typical community members. I am one of you. I pay 50% of my income for my housing costs and whatnot. And I think I am much more in tune and in touch with the community needs. I am the California Democratic Party endorsed candidate for Assembly District 75, and I look forward to working in Sacramento on our behalf on issues of health, housing, homelessness, highways, and habitat at the state level to improve our quality of life. I will work with all of our communities to heal from this public health crisis and to ensure in the future we have adequate health emergency preparedness for our state. Please visit me at kateforassembly2020.com to learn more about myself, my campaign platform. I would very much like to serve all of the citizens in Assembly District 75, and I thank you for your time.
And Dr. Rick.
Yeah, I just wanted to say thanks for inviting me, and I appreciate Liam and Kate including me in this conversation. medical scientists don't disagree at all about what we need to do to cope with the coronavirus crisis. And I would remind people that, the virus is not partisan. The virus does not care what political party you belong to. It wants to kill you no matter what political philosophy you hold. And good policy, evidence-based policy, should not be partisan. Larry Hogan, the governor of Maryland, and Mike DeWine, the governor of Ohio, Republicans. Jay Inslee, governor of Washington State, Gavin Newsom, governor of California, Democrats. All four of those governors listened to their medical scientists and put their states in lockdown early. And those states are all doing relatively well. Even Washington, that had the first outbreak, is actually coping pretty well given the circumstances. Good governance saves lives. Telling people that government is always the problem is dysfunctional, because right now, government is what we need right now to solve this crisis. Good government and policies based on medical science is what's going to help us. So I would just close with telling everyone, please listen to medical scientists. They will tell you the truth, because that is our profession, is to study the truth. Nature doesn't tolerate lying. Nature never lies. And so medical scientists should be guiding the policies by our governors and our politicians right now. That is what's going to keep everybody safe. And that would be what I'd like to remind people. I hope after this pandemic crisis passes, that medical science and science again becomes central in where we start forming our policies. Everything should be evidence-based in order to benefit everybody in our society.
All right, everyone, thank you so much for participating today. We appreciated having you all here. We appreciated having everyone at home. Stay safe, stay home. Let the medical professionals do what they need to do. And let's just all do what we need to do to stay safe, to keep our minds focused, do whatever it is that makes your heart glad and keeps you going. The next one of these that we'll be doing is going to be focused on education. For those of you who have children at home, you're trying to figure out how to get them educated, keep them educated, and get them onto that next step when they're at home and not with their teachers in their classrooms. We'll be talking about that and getting into the weeds with that. But for now, wear your masks, stay home, stay safe, and thank you all.